the two things that I want you to, that we're clear on is that, one, do we have a neutral zone and does it feel similar to the opposite side? Two, do we have an abnormal infill? Okay, so we have that pathomechanical infill, or we have a push and a soft and a pain problem where we're into that soft kind of joint. All right? So those are the things that you want to understand. Now you can do this in a few ways. You know, according to Diane Lee, we can just come on the front, and you want to be in a nice cupped position off that ASIS, so because you have a lot of tissue that's painful, and we're just going to rock it into a posterior rotation and rock it into an anterior rotation. So does it have a neutral zone? And remember, we're talking about a couple of degrees of movement, and you check the opposite. Okay. Did you see that difference? Okay. Yeah. Okay, here we go. There, there. Okay, kind of what I'd expect is normal. Here we go. Soft, boom. I mean, it falls apart. Okay, that direction's a little better. So now I know I have asymmetry in the neutral zone, and it appears by the infill that this one's going to be more suspicious of pathology because it's very giving. All right? Or we could have that big thing that's jammed up. Okay? So we have either the big jammed, there's a very barely a neutral zone, pathomechanical neutral zone, or an excessive neutral zone. Now, Jim, I think, goes through going through anterior posterior rotation, external rotation, internal rotation, straight up, straight down. Okay? And in terms of the neutral zone, that might not give you more information about how much is in the neutral zone, but it might give you information about a direction that may be provocative a little bit, so that is a little more painful coming as we're looking at angles, because these are different shaped, okay? And some of the how the fibrocartilage can get jammed up like a lid of a jar. It can get jammed up in some odd positions. Do you do all of them, Fred?
You know, we did the ones specific to handhold, so we got a sense of rotary and then superior, inferior, medial, lateral. So taking it not so much outflare, inflare, but abducted, so that the axis made sense, both supine and prone.
Okay, come up and show, because I don't do any of that.
No, but just these guys all know them. We did them on the last course, right?
Okay, and
Everybody's familiar with that. Remember that?
Review.
Yeah.
Just one more thing on this one here, like, so I can get a good axis, but if you really want to actually feel, you can palpate the sacral base and see if you can feel motion. And that's where we still feel that big give. Okay, so that might be a little bit better, but in terms of that assessment, that's all I need is in terms of assessment. So, Fred?
No.
Version?
So straighten it out for me. So you remember when Jim talked about this in terms of, did the positional work, but then fix on the top and we're pushing this way superiorly, right? Take the slide up, or fix below and push. Oh yeah, she's got a little bit of, and then the opposite, correct? Right? And then we did the medial lateral. So push this way, fix one, push, fix the other, so correct? Okay, and then we did the rotary, right? Fix and rotation, which would be more of a direct technique. Rotation, and then on your stomach. All right, so his point to it and how we did it was it should be exactly the same posteriorly, right? So then he did the base, right? At the top and ILA at the bottom for rotation, yes? They got a lot of yeses, nos?
Yes.
Okay, and we didn't do anything else with PSIS for posterior.
Okay, now, stop the camera.
For motion, yeah.